Welcome to CVS Health Live, an ongoing series that delivers timely perspective and insights around healthcare issues happening now. Today we'll be talking about mental health awareness and Women's Health Month that coincide together. This episode will focus on the toll COVID-19 pandemic has taken on women, on mothers, and caregivers. And if we just think about women and caregivers, 83% of women report significant increase in depression as a result of the pandemic. And when we focus on mothers, 80% of mothers say that they have been managing not only their work, but also their children's schooling within the home. So they're work professionals and they're teaching. And 55% of households, women are twice as likely to be the primary sole person responsible for cooking, cleaning, childcare, and education, as I had stated. So we know women are stretched thin, and it's having a major impact on their total mental health and well-being. I'm excited to share that we have a brilliant panel today of 3 experts. With us today is Dr. Joanne Armstrong, who is the Chief Medical Officer of Women's Health and Genomics for CVS Health. Beside her is Ashley Karpinski, a licensed professional counselor who leads our enterprise collaboration and innovation in our mental well-being and behavioral health efforts, as well as Kimberly Belmonte, Vice President, Girl Scouts Research Institute, Girl Scouts of the USA. And I'm Cara McNulty. I am President of Aetna Behavioral Health and Employee Assistance Program. Welcome. Dr. Armstrong, let's start with you. In your role, you're focused on helping to improve the health and well-being of women every step of the way. And I've heard you refer to women as the Chief Health Officer of the home. Can you talk about what you have seen broad-facing with women during COVID-19 and talk about the stress that you've noted with the mental and physical health of women during this pandemic?
So, you set it out that women are the chief health officers in their homes. They take care of themselves. They are the dominant person in the home that makes all the appointments for their children and their spouses. They close those preventive care gaps. And then increasingly, we're also doing this for our parents. So the whole health ecosystem of the people around us are run by us. And what women don't have is time. They don't have, a co-spouse in many cases to sort of lift up all the work that they do. And it is extremely stressful. So we need time. We need to have care accessible to us at these moments of time when we are actually available to seek it. So it needs to be personalized, right, to the circumstances of our own life. And then there are the enormous consequences of cost on seeking healthcare and closing those gaps. So COVID has touched all of those things. You've already talked about it, that there's just stress in and of itself working at home with other people working at home alongside you. We have become the chief educator in our family. As you say, the data says that we do this, 80% of the homeschooling is done by us, the healthcare, the taking care of the home, all of this, and it's extremely stressful. How that is played out in the receipt of medical care is that we see the receipt of medical care, preventive care for women has gone down significantly during this COVID pandemic, and it is worse for women than it is for men. For example, about 60% of women report that they have not received a recommended preventive service, compared to about half that much in men. The same thing is happening in the behavioral health space, that the rate of behavioral health challenges like depression and anxiety are higher in women, and you can understand because of the ecosystem that we're living in, and the receipt of that care has gone down as well. So we really have to do more to make care accessible, affordable, personalized to the circumstances, the real circumstances that women live, which means getting it right on time when you need it and squeezing it in before, between all these other jobs that we have.
Oh gosh, great points. One of the things that I have seen over and over, and I experience it in my own life, is that often women are caretakers and ensure that everybody else around them has had their preventive care visits, their vaccinations, yet often not taking time for ourselves. So thank you. I love the work that you're doing and how you're looking at women holistically so that we're ensuring people are getting the care and support they need. Ashley, as a mental health practitioner, the work you do is so important, and you are helping to engage our members and community members in getting the care and support they need. So when we think about the impact of COVID-19, how do we even know if someone is being affected by a mental health issue? Is it a mental health issue or is it normal stress? Can you talk about some of those signs and symptoms that we should be looking for?
Absolutely, Cara. I mean, as was mentioned earlier, COVID's impacted every aspect of our lives. Even how we celebrate has changed, or how we see our grandparents has changed, or how we celebrate death or birthdays or graduation. So new stress has arrived, right? And now we have to figure out what's normal stress, the new normal, and what's distress. When is it really starting to negatively impact our well-being? And that's hard to tell these days because everything feels harder than it once did. Some of the symptoms of emotional distress really start with changes for the individual, right? We all have our own personal normal pattern. So what I often tell folks when they call, because they do, to really think about, has your sleep pattern changed? Don't compare yourself. Often women and caregivers get caught up comparing ourselves to our neighbors or to the one down the street. But the reality is comparing you to you. Has your sleep changed? Have your eating patterns changed? Has your worrying changed? Do you feel it's excessive? Have you started drinking more than you used to, or smoking more, because that's a relief for your, stress? Have you found less time to get out and walk? And maybe that's something you enjoyed. So really starting to pay attention to changes and patterns. And that's really important because we often think of mental health or mental illness as, this thing that only happens to very few instead of a continuum of mental well-being. That's the goal here, is to start to clue in when things are changing for us so that we can get the help we need. And I think with COVID, because we've been so isolated, we're not seeing our girlfriends like we once did, or seeing our moms groups, our accountability partners to tell us we're not ourselves. And so we have to kind of tune in. And that's really what I encourage folks to do, is really, with this excess, extra stress or burden of taking care of others, and now being isolated, we have to really take our own pulse in many ways, and start to understand that under stress, we might be regressing and begin to guard our own joy. I really say that a lot at my house, is that we have to guard our joy, and that means protecting our mental health.
Ashley, I just love that. Guarding our own joy. It's like putting our own superhuman power shield up. That is amazing. And so, Kimberly, I'll move to you. I'm the mother of 2 teenage daughters, and I want them to guard their joy. And when we think about the work and the mission behind the Girl Scouts, your work to reduce stigma, to build girls' courage and confidence and character, to really advance the culture and ecosystem, to raise young women in a powerful and relevant way. How are you seeing the impact of the pandemic for young girls? And then how is that impacting mothers and caregivers?
Absolutely. So I work for the research team at Girl Scouts of the USA. And so one of our roles at GSUSA is to really understand what's going on with our members and what's going on with girls in general. And so halfway through the pandemic, we were working with our team of high school research interns, and we were actually studying mental health, and really trying to understand our Girl Scouts experiences with mental health, and also what more they wanted Girl Scouts to do. And that research was happening sort of when the pandemic hit. So it kind of created this natural experiment almost, or opportunity to really understand how our members were experiencing this really stressful time. And what we're hearing and what we're seeing from that research and additional focus groups with our parents, with our Girl Scouts, with our volunteers, is that, as others were saying, there is so much stress and anxiety. Our Girl Scouts are really stressed about the future, how the pandemic will maybe impact their prospects for college, what it means to be trying to take the SAT and the SAT keeps getting canceled, and that everyone's been on this kind of emotional roller coaster, and that emotional roller coaster is exhausting. And what that means for girls, what we've really heard from our members is that they're frustrated by the constant unraveling of routines. They're overwhelmed still by the uncertainty of cancellations. All of this, for some of them, is with the normal developmental processes of puberty. That's an extra challenge. And everyone, girls and parents, girls and their moms, are coping with some kind of grief. It might be grief because they've lost a loved one. It might be grief because they feel like they've missed out on so much in this past year. And this really means that for so many, trauma is living very close to the surface. It also means for our adults, for our moms in particular, recently one of our parents told us that she's so burnt out, she's crispy. And our parents are saying that they're very worried about their girls. Many have seen sort of an extreme difference in mental health over the past year. I've heard them describe their kids as, the light having gone out in her eyes because she's afraid to hope for the future. She's afraid because things have been canceled so many times. And we know the context, right? Kids have been dealing with remote school. It's completely different. Many parents have been working remotely or facing economic stressors. Those who've, had to cut back on hours have lost jobs or just lost income because of the pandemic. And all of this creates a lot of turbulence in the home. And when the parents feel that stress, when the moms feel that stress, their kids notice and they feel that as well. So it has been really challenging. I will say that one of the bright spots, one of the things that I hope we keep as we come out of this pandemic is that there's so much more willingness and openness to talk about mental health. So as one example, in our annual surveys, we found that over 9 in 10 parents or caregivers and girls want Girl Scouts to continue focusing on mental health and positive well-being. So we know that this is a priority for our members, and we're really looking at how we can continue investing and really building out those experiences for both our parents and our Girl Scouts to make sure that we are sort of keeping that well-being front and center, as we've done for so long, but even more acutely given the sort of crisis that we've all gone through.
Such important work. And as I said, as a mother of 2 teenage daughters, one of the things that we also see, I see personally in my own home, but we also see for the millions of members we serve through CVS Health, Aetna, the reality of micro losses. And so there's the grand loss of life, which has been, overwhelming in our communities. And for our young children and kids, we see these micro losses. You didn't get to go to prom. You don't get to take the SAT or ACT. You're at home, doing online learning. You don't get to hang out with your friends. Those micro losses leading up to bigger impact. It's so important to continue to look at how we raise these young beings to be their best and letting them know this is a snapshot in time. So really exciting, the work you're all doing. I'll pivot to Dr. Armstrong as we think about how we can support women and caregivers and mothers. We know that it's important to focus on not only physical health, but mental health. Can you talk about how we're transforming the delivery of care, and that delivery of care really from a total holistic health well-being?
We need to focus on women as one sort of holistic person. We don't live our lives sort of, now I'm someone who needs a pap smear and I've got a separate issue related to behavioral health. We are holistic people. We have to take care of our physical needs, our mental needs, and also our spiritual needs. We just had this beautiful discussion about the things that bring us joy, and these things are really important, right? And all of this has been challenged. And we need to bring our best self into our lives and our world because so many other people depend on us, right? So when you stand back and say, how do we do this? How do we help women on this path to their optimal self so they can be all of these things in life? We have to be realistic and really focus on the real lived lives of women, right? This issue about time and space and accessing services when we need them, not when they are necessarily open, right? Because I may not be available when they are open. So we have really thought, really thoughtfully about how we use all the assets that we have to make care personalized, accessible, as affordable as possible, really getting deep into communities. What that means for physical health for women is we have about 1,100 minute clinics that are deep in communities, and they provide a full range of preventive services for women: vaccinations, contraception, STI screening, bladder health, all sorts of sort of basic preventive services that women need. We also have, in about 14 states, we have pharmacists that are able to practice at the top of their license, which means they can prescribe contraception services. Why is that important? Because that's just one piece of physical health that influences so many of our life choices. And during the pandemic, and on a good day, pre-pandemic, about 30% of women said they have problems accessing contraception. During the pandemic, another 10% of women said, I'm out. I just don't know how to do this. So having these services available 7 days a week, locally in your community, no appointment necessary, or go online and get an appointment to access these services when you want them is really critically important. And then when you pivot to behavioral health and mental health, we are really moving in a creative way to meet this huge gap that exists in communities. It always has, but as we said, COVID has really just pushed this to the top of the list. So we are now making available behavioral health services in minute clinics that sit in what we call health hubs. And those are staffed by behavioral health social workers that really broaden dramatically access to this service that even pre-pandemic was very difficult for people to access.
I love how we are meeting people where they're at. Ashley, I'll turn to you as Dr. Armstrong teed up those mental health services with the licensed clinical social workers in our health hubs. Ashley has been on the core team developing those services. Ashley, talk to us about how we're delivering those services, what those services are doing, and why it's impacting communities and people in need.
Cara, it's probably one of the most exciting times in mental health. I remember as a mom driving, just begging to get in my car to get away. And I can imagine if I had walked in a CVS and someone said there was a therapist I could have spoken to, there were many days that would have been beneficial for me. And I'm excited to be in a company where we're able to do that. So exactly what Dr. Armstrong mentioned, we now in select health hubs or minute clinics have licensed therapists who can deliver both in-person and televideo mental health care. And what does that mean? It means you can go to cvs.com mental health and get a same-day mental health televideo appointment if that's what you choose. You can schedule and come into your local hub and be seen by one of our licensed professionals. If in fact you need medication, potentially you could also be seen by one of our nurse practitioners who could prescribe an antidepressant. We really want to move from this idea that you go treat your mental health over here and your physical health over there. We want to put the head back on the body. I think, Cara, I've heard many people say that before, and really start to realize that you could come to us and be buying a soda in the store, or you could be getting a flu shot, or you could be getting therapy, but really start to break that stigma around taking care of yourself and redefining that care includes mental health care. and it doesn't have to be a crisis. And so we're delivering assessments, evidence-based care, screening for depression and substance misuse and anxiety, things that many of us are living with every day, and helping create individual paths to care that might include ongoing therapy right there with your Minute Clinic licensed therapist, or maybe not. Maybe you do need something, a higher level of care, and you don't know where to start, which is often what I hear from many parents and many families out there, is that we just don't know where to start when we do need help. And we want to be there, right? We want to be in your neighborhood, in your home, on your phone. We want to be right around the corner, because we really believe that it's just-in-time care that's important. If you called today and said, I need help, and we said, great, in 8 weeks, I can get you in, and we'll talk about that really important personal issue, it really deflates people and often leads to additional stress and burden. So that's what we've built in our hubs, and we're learning a lot every day about what these communities needs and how we can continue to play a broader role in starting to close those gaps related to mental health care.
We've talked a lot about community members and individuals, but what's the role of the employer, and what do you see employers doing to lean into the need for mental health support and services?
Gosh, if we think about our daily lives, especially, most of us spend a lot of our days balancing work. Our employers, we spend a lot of our time with our colleagues, and more than we do often at home, although right now we're trying to do both full time, which is a challenge. Employers play a critical role. The first step as an employer is to take a time out and evaluate your culture. Is it a place that you can talk about these things openly? Is it a psychologically safe environment? And that doesn't mean I just say it is. Is it? Really doing a gut check around, do I have the right programs in place? Do we really have real conversations? Is it a workplace where people can bring their whole selves to work? I think Dr. Armstrong talked about, we don't want to treat just part of ourselves. We also can't show up as part of ourselves. And that's really an important part of the transition I think COVID has helped us instigate, is that people are having to be themselves, because we're working where we live, we're living where we work, we're educating, and that's really allowed us to show that I had kids and things we didn't know about each other, and employers are starting to embrace that.
Yeah, I mean, your points are so important, and I think about if we create psychologically safe environments, we can show up and be ourselves, and you're driving that inclusion, and inclusion drives diversity. And we know the impact that a diverse, inclusive culture has on community, on profitability, on just social advancement. So really important work. And now, Kimberly, I take that the next step and say, so we've talked about employers, we've talked about how individuals can get care, but how can parents and caregivers address the importance of mental health for our youth, and specifically females? We know the pandemic has impacted this population, as we've talked about, but what can we do to advance the efforts that you're all putting forward?
Absolutely. So first, I want to just say that I love the connections Ashley was making to, talking about minute clinics, talking about gender parity in the workplace, because this is such a systemic and structural issue. We see so many women who've opted out of the workforce during the pandemic, and we can't solve it with individual solutions. We have to really build those support structures. And I think that's such an important piece of all of this, whether we're supporting our working parents or supporting our youth. But at the same time, I do think that one of the most important things that parents, that moms in particular, can do to influence and support the mental health of their girls is really paying attention to their own self-care and their own mental health. So there's an element here of leading by example. First, because we know that girls are absorbing all of these messages. When they see their mom subverting her own needs, that child's learning what's expected for herself. right? CVS's study that found that when compared to men, women are more likely to agree that they often do not prioritize their own mental health because they're focused on taking care of others. If you're in a household where that's what you're seeing, you're absorbing that message as a child. And I think that maybe there's even a way sort of within that paradigm to kind of flip the script a little bit. So, if one of the most powerful things you can do as a parent is to model the behaviors you'd like to cultivate in your child. So there's an element here of putting on your own oxygen mask first, or maybe even parenting yourself or being gentle with yourself. But really showing your daughter that it is a priority for you to care for yourself and to take care of your own health. And one of the things, and this is maybe a little bit specific to the pandemic, but also, we did see this before as well, is being careful about body talk. So, there's a lot of conversations about eating a lot of bread, whether it's banana bread or having learned how to make sourdough and weight gain during COVID. But girls are hearing those things. And so when a mom in particular is talking about her own body or her own weight gain, those attitudes can really, influence the way that girls are thinking about themselves as well. So again, just really thinking of what kind of conversations are you having in the home? What kind of behavior are you modeling? Because that will absolutely trickle down and impact the way girls are really thinking about themselves. But when it comes to that relationship and really supporting girls, one of the things that is just key is opening conversation. A recent study found that just over 1 in 2 parents talk to their kids about how they're feeling, which means that 1 in 2 are maybe not talking to their kids about how they're feeling. And we need to make sure we're creating space for kids to talk to a trusted adult about things that are hard and understanding how to process when things aren't feeling so good. For our youngest kids, what in Girl Scouts we would call them our littlest leaders, this might end up being part of their play, and that's okay, right? It's okay if COVID becomes part of make-believe, or they start sort of acting out what they're seeing in the world through their imaginary play. This is the way that kids are processing. It's a way that they're making sense of the world. But even though, especially with teenagers, I'm sure you can see this, if we're asking too persistently, girls might get a little bristly around the edges, right? The repeated questions, but I think it really just is very important to create that open space because everyone needs connections. Everyone needs a space, and particularly in times where there's a lot of change, finding or defining that safe space is really important. And I'll say that despite the, fashion trend towards tie-dye right now, our youth and our girls in particular really need a peer-oriented space. So we need to make sure that there are ways to build that safe space, have those positive interactions, build those relationships with friends her own age. So this might be joining a club or an activity that can promote that kind of community and provide structure, nurture those friendships. This is something we do in Girl Scouts. And we've heard from our members is that one of the real key values of Girl Scouts over this past year has just been helping girls feel less lonely or feel more connected to other girls. We've heard from our parents that it's really been a source of comfort or provided a sense of normalcy in a time that was anything but normal. We also know that our programming really supports positive development. So, our research with alums shows that it provides a foundation for women to excel in education and careers, to become leaders at work, leaders in their communities, to feel an overall sense of satisfaction. And really any programs that are supporting that, positive social and emotional development, supporting well-being, are going to be key for giving kids those spaces. We also hear that youth today are really looking for ways to support themselves. We want to give up opportunities, particularly to our girls, to lead and to explore what interests them. So one way we do that in Girl Scouts is through the Girl Scout Gold Award. So this is the highest award that a girl can earn in Girl Scouts. And it's really a self-initiated project where girls are tackling issues of concern or need in their communities. And the goal is to drive lasting change. And since the start of the pandemic, we've seen over 250 girls who've started projects on mental health. So wanting to open those conversations, wanting to talk about things that are hard. And we're pulling this into our program as we start to develop new programs. So, we're really taking the perspective that we, as we always do, that we have to focus on the whole child. So what is that ecosystem or that support system? And so, when we look at wellness and Girl Scouts, we're looking at training and resources for parents, for our staff, for our volunteers. We're looking at, new wellness-focused programs, as well as creating those safe spaces for girls where they can connect with and support each other, so that peer-to-peer relationships. And we're looking to work with, national and local partners, so that we are partnering with those mental health experts who can really advise on how do we make sure that mental wellness is important and is a priority and is normalized, particularly as we enter this new stage of new normal for the whole country.
You know what? Such relevant points and advice, and I just thank you for the work that you and the Girl Scouts are doing. And I think about this conversation, we have people, experts, and on this panel and elsewhere coming at it from all different angles. And that's what it's going to take for us to drive a environment of hope and inclusion and really get people the care and support they need. In thinking about that, as we are winding down this conversation, Dr. Armstrong, can you tell me what you would say you're doing to ensure we address women holistically, and one thing that you do personally to improve your own mental health?
I like to reflect on the fact that we just celebrated Mother's Day, and Mother's Day is the day that we honor women, moms, for the roles they play in their families, keeping their health, spiritual health, fun, all of it going. And I think we honor women more broadly during this day. When I think about this, I think about it as a time to recommit and reprioritize both our personal commitment to prevention and wellness, both in general health and in mental health, and really for all of the systems that we talked about here. The advocacy groups, the educational partners, our employer partners, to really lift up all of this. It takes a lot to lift it all up. So that's what my commitment is, to sort of work on some of the medical pieces to address these issues of access and care. And when we think about prevention, it is an expression of self-love, right? I have to take care of myself before I can take care of everybody around me. So that's sort of the spirit that I bring to my work here, to sort of break down these barriers, but really think about women in the real world. Like, what are the real challenges versus solutions that maybe are out there, but they actually don't meet the needs of women. And then sort of my own personal commitment. I have 2 daughters, one in college and one is about to launch. I recognize the complete conversation that Kim and Ashley talked about. There was a modified prom on a football field, SATs that were canceled and so on. So the commitment that I have made is to use the fact that we are living together more closely than I hope to for her senior year, to really talk to her a lot. We walk every night, most nights, sort of in the darkness, just to open up a space for a conversation to talk about this year and sort of what her future might look like. So for me, it's actually been a blessing, a stressful year, but in some ways it's opened up opportunities that I didn't anticipate that I would have. So I would encourage women to sort of look for that, think about gratitude where it's available, being pragmatic, but also being thankful that some of these things that felt like lemons really are lemonade.
Outstanding. I love that you are highlighting self-love. Really important. Ashley, I'll ask you as our close, what's one piece of advice you have for women and mothers as they continue to do this really important work in the home, in the community, and in the workplace?
That is such a hard thing to narrow down to one thing. As I was reflecting on this discussion, and I heard, CEO and COO of the work of the home, and I'm wondering if we might not need to be the CMO, right? The Chief Mental Health Officer of ourselves. And by that, I mean just allow ourselves some grace. To me, mental health starts with just tuning in and not tuning out. Often we're tuning into everybody else's needs and not our own, and just taking our pulse. How are we doing in our relationships? How are we feeling personally? How are we functioning ourselves. And how often do we take our own pulse in that way? And be honest, because it's really hard to continue to give if we don't refill our own tanks. And I think that's the most important message out there, is that we have to lead by example. I think we've heard that throughout today. And in order to do that, that means sometimes taking a time out and taking time for ourselves to refill.
Well, I would like to thank you all, Kimberly, Ashley, and Joanne. Thank you for your dedication and advocacy for young girls, adolescents, young women, and women of all ages as we advance the total health well-being of the populations we're all serving. As we close out this session, you can visit the address on your screen for additional information. And I'll close by saying now is the time, there's never been a better time, to take care of your own physical, mental, social, emotional health so you can be there for others. Thank you and have a great day.